Good afternoon. Sorry, I can't speak Spanish, so I will try to speak English slowly. My English is not good too. I will talk a little about the implementation of the project in Brazil. So, in Brazil, we started with 15 sites in 12 cities. Now we have 14 sites because one site could not conduct the study in the best way. We have 8 states that have these 14 sites, that is Amazonas, Pernambuco, Bahia, Distrito Federal, Rio de Janeiro, São Paulo, Santa Catarina e Rio Grande do Sul. At this time, today, we have 3,261 participants in the study in Brazil. And here you could see the number of participants in each site. Some information about the participants is about the age. Half of the participants have between 25 and 34 years old. Most of all have 12 years of education or more. That's not really good, but it's the reflection about who will know about PrEP first will be those who have more access of education. It's something that we need to change. A good thing is that about half of the participants included in Brazil, it's non-white participants. That's good. And it's still, we need hard work to have more trans people in the study. In Brazil, we have 4.7% of trans included in the study. The prevalence of syphilis, this is a preliminary data. It's 10.4. For chlamydia, 10.6, and for gonococcus, 6.4. In this project, we initiate PrEP in the same day we check the criteria, so we don't have a screening and then an inclusion visit. So we could see that only 5 participants need to be excluded because had a result of creatinine or clearance of creatinine that was not adequate. So it's secure till you check the criteria and give PrEP, and then you check the results of this renal function. From these 3,000 participants that it's enrolled, 17 was diagnosed with acute HIV infection by a detectable viral load in inclusion visit. Just to explain, in the study we use a rapid test in all visits, but in the inclusion visit we collect a sample, a blood sample, to check, to investigate acute infection. And we find 70 participants that in the inclusion had a detectable viral load. It's a little number, so we believe it's secure to give PrEP to in the same day. You don't need to keep investigating. You will be having a little number. But it's important to us to check and think about if we need better tests to know about the HIV infection. The challenges that we had for the implementation is about, as we had 15 sites, each site had a local IRB, and each site had that time to approval. So the sites did not begin at the same time. That's why it's the difference in the number of inclusion in different sites.
Comité de ética. IRB
yeah.
es comité de ética.
Yes. the capacity of the health service to absorb the total demand of PrEP. We have in Brazil, only physicians can prescribe PrEP, so we have a low number of physicians, and we discuss about nurses could come into this kind of attendance, and we still need to increase the knowledge in PrEP among population that can most benefit for this technology. So the youngers, the less educated, the trans people, and we still have to work about retention in adherence. We still in the middle of the protocol. We still don't have numbers like this, but we know it's something that we keep needing to work about. The facilitating factors is in Brazil we have a full support of the Ministry of Health. We are working together. PrEP in Brazil is offered for free in the public service, and ImPrEP is working monitoring this implementation. Funding to facilitate community engagement. We have a community advisor board. We have peer educators in all sites trained by the study. These peer educators, it has monthly calls that we discuss all the improve and all the work and what they are doing and how we could help. And we are training new PrEP service. The ImPrEP together with Ministry of Health offers new trainings for new service to offer PrEP. And we offer refresh training for the study sites. That's what I had to say about Brazil.
Yeah.